Okay, ready for a deep dive. We're tackling orthopedics this time, and wow, you weren't kidding about a treasure trove of info. 100 orthopedic, multiple choice questions. You really went all out.
Well, it's a classic way to test knowledge in medicine, right? But no pressure. We're just here to have fun with it, find those connections, maybe bust some myths.
Love that. I have a feeling with this many MCQs, we're bound to run into some head scratchers.
Indeed. Let's start with a familiar one, though, fractures.
Ah, the classic broken bone. Though it feels like there are a zillion types of fractures out there,
Yeah.
where do we even begin?
You're right about the types. There are a lot. But the type often tells us a lot about, the force involved, the person's age. Like green stick fractures, those are almost always kids.
Right, because their bones are still so bendy.
Exactly, like a young tree branch, right? Bends and cracks instead of snapping. Same with kids' bones. Still growing, haven't hardened fully.
Makes so much sense. It's amazing how much our bones change as we age.
Yeah.
Speaking of, what about a march fracture? It sounds kind of funny, like something you'd get from, well, marching.
Well, there might be some marching involved, but not how you'd think. It's a stress fracture, usually in the foot. You know those long bones right before your toes? Metatarsals. Got the name because it was common in, well, soldiers who marched a lot.
So not the marching itself, but the repeated stress.
Precisely. And it's not just soldiers either. Anyone who suddenly does way more activity, especially if it's impact on the feet. Runners, dancers, even someone who starts taking long walks every day.
Huh, guess our bones need time to adjust to new routines, just like our muscles do. Okay, on to a fracture with a way less pleasant name. Dinner fork deformity. What is that even?
The name is, it's pretty accurate and, yeah, a little unsettling. We're talking Colles fracture here. Happens in the radius bone near your wrist. Imagine falling onto an outstretched hand.
Ouch, yeah, I've done that.
So that force can actually push the broken part of the radius backward, creates a bulge on the wrist that looks like, well, you guessed it, the curve of a dinner fork.
Okay, ow. Yeah, that image is vivid and not in a good way.
Mm.
So we've got fractures in kids, overuse fractures, fractures from falls. I'm sensing a theme here. There are a lot of ways to break a bone.
More than we have time to discuss, that's for sure. The body's amazing, but bones can only handle so much.
And speaking of vulnerable, our wrists seem particularly prone to problems. Why is that?
Well, think about it. We use our hands and wrists constantly. They're in almost everything we do. And one bone in particular is really fragile, the scaphoid.
The scaphoid. Had to brush up on my bone anatomy for this deep dive, not gonna lie.
It's easy to miss. Small bone, shaped kind of like a boat on the thumb side of your wrist. And believe it or not, it's the most commonly fractured carpal bone.
Really? It seems so tiny.
That's part of the problem. Because it's small and where it's located, it gets hurt a lot and falls, especially when people try to catch themselves. And to make matters worse, blood supply to the scaphoid isn't great, so healing's complicated.
So, small bone, big job, and prone to causing trouble. Noticing a pattern here. Speaking of trouble, what's with those ganglion cysts? The ones that pop up on wrist.
Those are interesting, basically fluid-filled sacs. They develop on tendons or joints, and yeah, the back of the wrist is a favorite spot.
I've always wondered what those weird bumps were. Seem so random.
They can be, yeah. We don't always know the exact cause, but usually ganglion cysts are benign, don't cause pain. If they get big enough to press on a nerve, though, that's when you get discomfort, maybe weakness.
Good to know. So, fragile bones, mysterious cysts, wrists are a hotbed of orthopedic intrigue. Moving on, let's talk spine. The MCQs say the discs between C5 and C6, those are the most common for herniation. What's going on there?
It's a few things, but basically, that part of your cervical spine, your neck, it's under a lot of stress, especially these days.
You mean all the time we spend hunched over our phones? Tech neck.
Right. Bingo. Head constantly forward puts extra strain on those discs in your neck, especially lower down like C5, C6.
Yeah.
Add in repetitive motions, the fact that, well, we age and things wear down. It's no wonder that area is prone to problems.
It's true. Those small stresses add up over time. Speaking of things we might not feel immediately, let's talk about Volkmann's ischemic contracture. That name sounded tense.
It is serious, yeah. It's about blood flow, or lack thereof, to the forearm. Can be caused by a few things, often a fracture or something called compartment syndrome, where pressure builds up within a muscle.
Okay, and lack of blood flow, that's a problem
Because muscles and nerves need oxygen, obviously, and nutrients. Blood carries that stuff. Cut off the supply, you get damage, pain, weakness, even deformity if it's not caught early.
So early detection is key. What are the warning signs? Anything people should watch out for?
Pain, that's the big one. Can't miss that. But with Volkmann's, the pain might be, like, way more than you'd expect for the injury.
So, like, you fracture something, but it hurts way, way worse than it should.
Exactly. That level of pain, especially with numbness, tingling, swelling, any of that, never ignore it.
Our bodies do try to tell us when something's wrong, even if we don't speak the language, huh? Now, on to something that seems like the opposite of Volkmann's, at least in how long it lasts. Perthes disease.
That one's mainly a kid thing. Affects the hip, blood flow gets interrupted, but temporarily. Causes pain, limping, limited movement. Can be scary for parents to see, but the good news is, usually clears up on its own within a year or two.
So, like, the blood supply to the hip takes a vacation. What causes that, especially in kids?
Ugh, the million-dollar question. We don't know for sure. Could be a bunch of things together. Genetics, clotting problems, even minor trauma to the hip over and over.
It's wild how much we still don't know about the body, even with all the medical stuff we have now.
It's true, every answer just leads to more questions, it seems.
Speaking of questions, let's shift from those weird conditions to some treatment basics.
Good to have a solid foundation.
Right. So, fractures, the MCQs are clear, immobilization is key. But why? Seems obvious, keep the bones still, but is there more to it than that?
Definitely. Immobilizing, whether it's a cast, splint, whatever, it lets those broken ends knit back together properly. Like setting a bone, gotta hold it perfectly still so it fuses the right way.
So it's not just preventing more injury, it's actually creating the right environment for healing. Makes sense. Speaking of early intervention, what about clubfoot in babies?
Ah, yes, early is key with that one, for sure.
What makes it so important in that case?
Well, clubfoot, it's not just one thing, it's a bunch of misalignments in the foot and ankle. But with newborns, those tissues are still really moldable. Address it early with, say, the Ponseti method. You can often correct it without surgery.
Ponseti method, what's that involve?
Pretty cool, actually. Gentle manipulation, stretching the foot into a better position than putting it in a cast. Each cast gradually corrects it a bit more.
Like a series of tiny tweaks over time.
You got it. Uses the baby's own growth to guide the foot and ankle where they should be.
That's incredible. It's amazing what they can do these days.
It really is. Shows how important early diagnosis and treatment are for so many orthopedic things.
And on that note, we have to talk about the king of orthopedic complaints, low back pain. The MCQs had this surprising fact: the most common cause is unknown.
It's true. Might sound bad, but gotta understand what we mean by unknown.
Okay, break it down for me. What's the deal with this mysterious back pain?
So a lot of times we can find the cause, right? Muscle strain, herniated disc, arthritis. But a good chunk of cases, they're non-specific.
Meaning they can't tell what's causing it.
Yeah. Doesn't mean there's any cause, just that it's not clearly one structure or condition. Sometimes it's a bunch of factors. Sometimes it's something we don't easily see on scans, like ligaments or muscle imbalances.
So not necessarily that nothing's wrong, just that the cause is more like multi-layered.
Exactly. That's why a good assessment is so important. Exam, history, maybe imaging. Got to figure out the best way to treat it.
So the MCQs give clues, but nothing beats a real doctor's expertise.
100%. Self-diagnosing, especially with back pain, that's risky business.
Noted. Before we get totally lost in the mysteries of the spine, one last fact from the MCQs. Medial meniscus tears in the knee. Those are more common than lateral tears. Why is one side more prone to injury than the other?
Anatomy, plain and simple. Medial meniscus, that's the one on the inside of your knee. It's attached more firmly to the tibia, your shin bone, compared to the lateral one.
So it's more like solidly anchored in place. How does it make it more vulnerable, though?
Think of it like this. You've got two ropes, one tied tight to a pole, the other one's got some slack. Which one moves more freely? Same with the menisci. The lateral one, with that looser attachment, it can glide around more. The medial one, it's more restricted.
So that secure connection is good for stability, but it also makes it less able to get out of the way when the knee twists or something.
Exactly. So quick turns, pivoting, that medial meniscus can get pinched between the femur and tibia, and boom, you've got a tank.
Like it's stuck in an orthopedic tug of war and it loses.
Laughs, that's one way to put it. Seriously though, it shows how important proper biomechanics are, especially in sports, with lots of pivoting, cutting, all that. Gotta protect those knees.
So true. Technique and training, they matter. Well, I'd say we've covered a lot in just this first part of our orthopedic deep dive. Bone breaks, low back pain mysteries, even learned some fun facts to impress my doctor friends.
We've only scratched the surface of orthopedics. There's so much more to uncover.
I'm ready. Let's unearth more orthopedic gems from these MCQs. What else do we have?
We've talked bones, but what about those unsung heroes of movement? Our nerves. Things get interesting, well, complicated, when nerves get involved with these injuries.
Ooh, you're about to tell me about a time you saw an x-ray and thought, no big deal, and then, bam, nerve damage changes the game.
You know me too well.
Hmm?
Happens more than you'd think. Take a shoulder dislocation. Common injury, right?
Yeah, I've heard of those.
On an x-ray, you see the bones out of place. Easy. But what you don't see is any damage to the brachial plexus.
Okay, remind me about the brachial plexus. What is it again?
It's a whole network of nerves. Starts in your neck, goes down your arm, controls everything. Shoulder muscles, feeling in your fingers, the works.
So if those get damaged during a dislocation,
Could be a lot of things. Depends how bad it is. Temporary numbness, tingling, that's the best case. Sometimes, though, muscle weakness, even paralysis.
now that shoulder dislocation sounds a lot more serious than just a popped bone.
Exactly. You always have to check the nerves after a big orthopedic injury, even if the x-ray looks simple.
Nerves, they really complicate things, don't they? Speaking of nerves and things going wrong, Saturday night palsy, is that a real medical term? Sounds like a result of sleeping weird after one too many drinks.
It's actually radial nerve palsy, but yeah, you're not far off. Happens a lot after someone's been drinking, falls asleep in a weird position, compresses that nerve.
And the radial nerve is.
Another key player in your arm. Controls the muscles that straighten your wrist and fingers, gives you feeling on the back of your hand.
So compressed too long.
You wake up with wrist drop, can't extend your wrist, hand just hangs there. Usually temporary, but definitely alarming. And a good reminder to watch how we sleep off those nights out.
Duly noted. No more sleeping on hard surfaces after a party for me.
Good rule of thumb in general. Now, while we're on nerves and complications, let's go back to Volkmann's ischemic contracture. We talked about it before, but the MCQs mentioned something about wrist position being a clue.
Right, you said early pain is key. But there's something about how the wrist moves, too.
Yes. One way we check for Volkmann's is we ask the patient to extend their wrist. Imagine tipping a waiter, that motion.
Yeah.
We look at their hand and fingers.
What are you looking for?
Normally, the fingers should straighten all the way out. With Volkmann's, they might have a lot of pain trying to do that, and their fingers might stay curled, can't fully extend.
So it's another one of those things. The body gives us hints. Something's wrong, but we don't always get it right away.
Exactly. A good physical exam, asking about their history, that's crucial in orthopedics.
Like detective work, piecing it all together.
Mm.
Speaking of clues, let's switch gears from nerves to pain. The MCQs said that the joint capsule, that's the most sensitive part of a joint. What makes it that way?
Nerves, again. The joint capsule, it's like this sac that encloses the joint. It's loaded with sensory nerves. They tell your brain about pressure, movement, and most importantly, pain.
So it's like the joint's alarm system.
Exactly. Something's wrong in there, inflammation, injury, whatever. Those nerves in the capsule, they're the first responders. They tell your brain, hey, we got a situation down here.
Wow, never thought about the joint capsule like that. Makes sense, though. Pain is our body's way of telling us something needs to change.
Right on. It's not something to just ignore or cover up. It's a signal to figure out what's wrong and fix it.
I like that.
Oh.
Now, on to a classic injury. The dreaded shoulder dislocation.
Mm-hmm.
What makes our shoulders so good at popping out of place?
We're designed for mobility. Our shoulder joint is the most mobile joint in the body. Amazing range of motion. But that comes at a price. Stability takes the hit.
Can't have it all, huh?
Pretty much. The socket in the shoulder, called the glenoid, it's shallow. That ball at the top of your arm bone, the humerus, doesn't have much to hold on to. Like balancing a golf ball on a tee, not hard to knock it off.
So we trade stability for that amazing shoulder movement. And sometimes that means a trip to the orthopedic doctor.
That's the unfortunate truth. But let's talk lower body for a bit. I mentioned meniscus tears, but I think it's worth digging into why that medial meniscus seems to get hurt more than the lateral one.
Okay, you said it's less mobile, so it tears easier. But what makes it less mobile in the first place?
It's all about how they're attached inside the knee. The medial meniscus, that C-shaped cartilage on the inner side, it's attached way more firmly to the tibia, your shin bone, than the lateral meniscus is.
So it's like real anchored down. How does that make it less mobile, though?
Imagine two ropes, one's tied super tight to a pole, the other's got some slack. Which one can move around more?
The one with slack, obviously.
Yeah, same idea with the menisci. The lateral one, looser attachment, it can glide around more during movement. That medial one, it's stuck where it is because of that tight connection to the tibia.
So good for stability, but it can't get out of the way as easily when, say, the knee twists.
Exactly. And that's why quick turns, pivots, that medial meniscus can get caught between the femur, your thigh bone, and the tibia. Then you get a tear.
Like a game of orthopedic tug-of-war, and the medial meniscus, it's outmatched.
You could say that, but seriously, it's important to have good biomechanics, especially for athletes who do a lot of pivoting, cutting. Gotta protect those knees.
So true. Good technique, proper training, it all helps. Now, we've covered a lot, nerve damage, joint pain, but there are a couple more conditions from these MCQs I want to understand.
Let's hear them. I'm always up for a challenge.
All right, these two sound really similar, but affect different spots. Stenosing tenosynovitis and carpal tunnel syndrome. What's the difference?
Those two always trip people up. Both involve pressure on tendons and nerves, lead to pain, numbness, tingling, but location is key. Stenosing tenosynovitis, it's also called trigger finger. Usually in the hand, near the base of a finger, the finger gets stuck bent, like pulling a trigger.
Ouch, I see why they call it that. So carpal tunnel is the same idea, but in the wrist?
You got it. Carpal tunnel syndrome is all about the median nerve. It gets compressed going through a narrow spot in your wrist called that, carpal tunnel. Numbness, tingling, pain, all in the thumb, index, middle finger, sometimes part of the ring finger too.
Stenosing tenosynovitis, trigger finger, carpal tunnel syndrome, trapped median nerve. I'm getting it. Stenosing tenosynovitis, trigger finger. Carpal tunnel syndrome, trapped median nerve. I'm getting it. Now, you said that sometimes low back pain, we don't know the cause. But when we do know, what's usually to blame?
The intervertebral discs, most often. Those little cushions between the vertebrae and your spine.
Right, like shock absorbers for our back. What goes wrong with them, though?
They can bulge, herniate, or just wear down over time. All of that can press on nerves, even the spinal cord itself. Pain, numbness, weakness, you name it.
Oh, that sounds awful. Makes you realize how much stress our discs are under just from, everyday life.
Exactly. Good posture is so important. Core strength, lifting properly, all that stuff we know we should do. It really does make a difference long term.
So true. Be nice to your spine, folks. Speaking of being nice, what about Perthes disease? That one where blood flow to the hip stops, especially in kids, it still seems so weird to me.
It's a head scratcher for sure. We know it involves that interruption of blood to the femoral head, the ball of the hip joint, but the exact why, still a mystery.
Any good guesses out there? Theories? Anything like that?
Oh yeah, plenty of theories. Could be genes, maybe kids are more prone to it if they have subtle clotting issues. Some even think it's repeated little traumas to the hip adding up, but nothing conclusive yet.
Wild. With all the fancy medical stuff we have, there's still so much we don't know. Kind of humbling.
It really is. The human body always keeping us on our toes.
That's what makes these deep dives so fun. Speaking of mysteries, we can't forget about the low back pain with no clear cause. Fascinating and kind of unsettling at the same time.
Right. Shows just how complex pain is. We've come a long way, but still so much to learn about how it all works.
So even with all these multiple choice questions, more questions than answers today.
In a way, yeah. But that's how it should be, right? Each answer just opens up new questions to explore. These MCQs were a great starting point, though. We covered a lot, and I think it helps us appreciate how amazing and intricate the musculoskeletal system really is.
I agree. What a ride, huh? Bones, muscles, tendons, nerves, all the things that let us move around and live our lives.
And hopefully our listeners are walking away with some useful nuggets of knowledge.
For sure. If they only remember one thing from this whole deep dive, what should it be?
Listen to your body. Pain is telling you something. And with orthopedic stuff, early on is always better. Don't ignore those aches and pains. Talk to a professional. Be proactive about your health.
Couldn't have said it better myself. And to your point from earlier, even with clear-cut answers on those MCQs, it's obvious there's always more to learn. The human body is incredible. Its ability to heal, adapt, all of it.
It's a lifelong journey, figuring it all out.
Well, listeners, that's a wrap on our orthopedic adventure. As you go about your day, think about this. What's one little thing you can do to take care of your amazing, complex, sometimes confusing musculoskeletal system?
Until next time, stay curious, stay informed, and keep moving.
Keep on diving deep, everyone.